everyone. My name is John Sadler. I'm a professor of psychiatry at UT Southwestern in Dallas, Texas, USA. I'm honored to participate in this debut uh, philosophy of psychiatry education group for INPP. I thank Dr. Awais Aftab for his generous offer to include me. This is a recording. I'm really not on Zoom at this moment. I had a scheduling conflict, so I did my own Zoom recording. So here I am. I will now share my screen with you and we'll launch into my talk. So this is my identifying information. I'm not need to read it to you. It's mostly supplied for the links below. If you'd like to write to me with questions and comments, john.sadler@utsouthwestern.edu is down there. We have our ethics program website. And let me just point out the sagacity.org site down below, which is an online archive of interviews with philosophers of psychiatry. They're up to an hour long. They're intimate and detailed and have lots of ideas, so they're recommended. For today, to just share my information, I've been teaching a UT Southwestern elective in philosophy of psychiatry for over 20 years now. I'll be talking about the context of the elective. I'll show you the goals for this short lecture. I'll be talking about how to prepare residents to be curious about philosophy, that is, in leading up to them wanting to take the elective in the first place. I'll give you some particulars about the elective, and then I'll share hopefully some accumulated wisdom and educational tips that I've learned over the years. And then just for reference sake, I'll list some of the more popular or stalwart readings in this regard. So the context of the elective, it's 10% time, and it's offered to our senior residents, that is in their last and fourth year of training. It takes 10% of time. We have one contact hour per week, but they have weekly readings that are pretty substantive, week in and week out. It lasts all year, from basically August through their graduation in June of the following year. Why do I have senior psychiatry residents and not offer to early residents? Well, earlier residents are still learning. They're anxious about practice. They want to do the right thing. They're worried about developing fundamental skills and fine points of practice, and a more critical attitude about the field are only developing. And so by the time they're senior residents, they have less anxiety and more critical perspectives on the field, which makes their minds ripe for this sort of an experience. I only accept 3 residents, and it's seminar oriented. We meet, like I said, for an hour a week. There's lots of coaching of the reading material, and then later on coaching about the writing of philosophy. And a lot of that coaching has to do with writing coaching and not just philosophy writing coaching. So both those general and specific skills are addressed. We call it an intensive reading seminar. It basically has 2 parts. The first 6 months, the sessions, we read an introductory philosophy text chapter by chapter and discuss in the seminar. In the second 6 months, then they prepare a short essay on a topic of interest in the philosophy of psychiatry that makes a philosophical argument or analysis. And so it's all about first reading philosophy and then hopefully doing some philosophy. as many of you know, we don't really do it until we try to write it down. So the goals, what I'd like to do today with that introductory information in mind is I'd like to address why do some residents take this elective. I'd like to discuss the importance of preparing the resident for philosophical interest. I'd like to share some of the mechanics very briefly in the US psychiatry training context. And it offers, as I mentioned, some of my accumulated wisdom of teaching this over the past 20 so years. And then I share some of those materials I mentioned earlier. So only a few residents every year are interested in considering the elective. Excuse me. Fourth year residents don't see the elective in the catalog and take it because it's compelling interest of the course of the readings. So it's not that sort of thing. Rather, philosophically receptive minds respond to certain experiences over their training years that cultivate an interest in philosophy. And I like to call these readying experiences for pursuing philosophy more in depth. So what are and are not these readying experiences over the preceding 3 years of inpatient, outpatient, and consultation training in psychiatry? So one of these readying experiences is the experience of moral distress in doing clinical work. How to live with involuntarily treating someone as an example. So readying for philosophy happens when the attending explores both the ethical basis and the moral emotions laid bare that the resident may be experiencing regarding moral distress in clinical work. Using ethics education seminars that are routine in residency training is an opportunity to discuss the resident's own cases and cognitive rehearsed common cases not yet encountered. And so this introduction through clinical ethics to philosophical kinds of reasoning is also readying experience. And then in everyday clinical supervision, regardless of the setting, clinical, inpatient, outpatient, CL, et cetera, supportive yet Socratic inquiries about why clinical actions are taken is part of the readying experience set. We want to inculcate a critical philosophical attitude and sort of illustrate by guiding residents through their reasoning that philosophy works. And indeed, perhaps one of the things that a philosopher of psychiatry can do that other philosophically sophisticated clinicians don't is link things like distinction making to residents' clinical reasoning and basically showing them that they're already doing philosophy in their everyday clinical reasoning. So regarding further readying experiences, in clinical supervision of residents, we often engage the underlying conceptual issues of clinical problems they face. And so there, everyone knows there are dozens of these that we encounter daily. So for example, why do breakthrough symptoms appear in the face of situational stressors and otherwise stably treated patients? Why do some faculty diagnose with the DSM by rote and others informally imply DSM criteria? Why are the most effective drugs in our field, like stimulants and benzos, the ones that are most prone to abuse and that we're most stingy and conscientious about prescribing? How do we reconcile narrative and biological understandings of patients' distress? These are just some examples. I'm sure you all can come up with many, many more. So we also wanted to engage the underlying conceptual issues of the clinical problem they face. And many of us have written on these sorts of issues. We want to model philosophical practice. And presumably your skills, knowledge, and attitudes derived from philosophy have infiltrated into how you do clinical work. You can make this explicit by talking about how you think through things with the residents and not simply think through things with the residents. Particulars about the elective. So I use this book by William Earle that's very old now. It's now, what, 30 years plus old. It's out of print, but it's super cheap online. Introduction to Philosophy by Bill Earle. Do I recommend it for people thinking about starting an elective, something like this? No, I don't recommend it. You should pick a book you like and know. What I do with the Earle book is I have the residents read chapter by chapter, organized by sub-disciplines. And because it's so far out of date and so old, it's basically super cheap. And so it provides no cost barrier. We alternate our readings between chapters, and then I pick a relevant article from the philosophy psychiatry literature that then ties to the introductory concept. So for example, if we have a philosophy of science chapter, then I'll pick an article from the philosophy of psychiatric science, so to speak, and we'll read that. And so that the residents can then see how these fundamental perennial issues in philosophy subdisciplines apply to psychiatry. The book reading is completed by mid-year. What do we do within the hour? We talk about key nomenclature and concepts and help them understand them. Oftentimes they need lots of help because they're new, and our residents rarely have any philosophical experience prior to this. The kinds of questions asked by the philosophy subdiscipline. So I think this is a really important part of helping residents understand philosophy as a diverse discipline, which is the various subdivisions, specialty areas in philosophy, asks their own unique sets of questions. Of course, these bleed over one into another in many cases, but having them start to understand how subdisciplines can address more focused questions is crucial. Learn how we also would like them to learn how this field can contribute to the practice of psychiatry. And so I take special pains to cue the residents to give examples about how this might be relevant to practice. And I certainly supply them myself frequently from session to session. What do we do with the seminar hour otherwise? Once we completed the book and read some of the current literature, like I've described, we discuss hopefully areas of particular interest that our reading so far has awakened. We focus down on a philosophical question that requires a lot of coaching and work with each of the residents. We build skills in finding relevant literature for the topic in question. And this can be both general searching the literature skills, but also finding out where the philosophy papers are. We share experiences with each other's work, and then we rotate progress reports each week until the paper is completed. And this is all again during the second 6 months of the year. Some of my accumulated wisdom here: residents generally don't have any prior experience with philosophy, and so you really have to approach them as very bright but uninformed students. With readings, I'm very active in clarifying ideas, applauding their insights, and when they pick up wisely flaws in reasoning that the residents pick up from their readings. They'll need much help and understanding early on. And so I find myself very active in even doing most of the talking in many of the early discussions. The virtue of using the old Earle book that I've mentioned is that I've riffed on this book for years now, and much what I do with each chapter is well learned and easy for me to implement. it's a skeleton that I can hang contemporary ideas on. And so if you're starting from scratch, I pick a good introduction to philosophy book that's short, clear, and hopefully inexpensive. Reading the residents' affects or faces are important, as with any teaching exercise. Oftentimes, those nonverbal cues will be occasions for you to encourage sharing. This seminar may be the only place in their training where any challenging or skeptical question is met with welcome and curious attention. Again, not all of our colleagues, as conscientious educators as they are necessarily holding a philosophical attitude of curious exploration. And this is one of the things that I think is both attractive to the residents, as well as important for them to learn for themselves. During the COVID pandemic, I've done this seminar over Zoom, and I've taken to use, actually at the residents' request, video and audio recorded sessions. And so absent residents can view later or even listen to the audio as a sort of podcast. I could share a sample or two of these if you were interested, and if you are, just email me on my address on my title slide. And many, perhaps most of the residents need help in staying on a research writing schedule. So meeting time, using your meeting time to plot that and hold their feet to the fire, keep them on schedule, help them develop a schedule that makes sense and is logical in developing their paper is important. I find many of the residents haven't written a paper other than clinical history and exam since they were in college. And so many of them are quite rusty in doing a composition. Here are some of the popular or stalwart readings that I've mentioned. I'm not going to go through each of these. Again, they're for your reference, and I've supplied the team with these slides in case people would like to see them. Thanks for your attention. And I wish the best of luck to you all in your educational interventions, and hope to see this group develop as a resource for each other.